Hello, my name is Seth Greene. I'm a student nurse. I'll be doing your physical assessment today. What's your full name?
Daniel Jones.
Excellent. Mr. Jones, where are you right now?
I'm at the doctor's office.
Excellent. What day of the week is it?
Today's Tuesday.
Excellent. I'm going to assure patient privacy, closing the curtain. I'm going to hand sanitize, hand wash, clean my stethoscope, gather my equipment as needed. My patient's already spoken to me. I watched him come in, assessing for his mobility, any deformities that I witnessed, that I see. He's speaking to me in full and complete sentences. He's alert and oriented. Noticing his affect, his stature, his mood, his behavior, all within normal limits and expected. He's neither over nor undernourished. Any odors, he's well dressed, and again, he's alert and oriented. Doing an environmental assessment if we were in the patient's home looking for any safety concerns. Can I see your armband for a second, sir? And what's your full name again?
Daniel Jones.
And Mr. Jones, what's your date of birth?
10/04/89.
Excellent. Fully identified my patient. Mr. Jones, we're going to be doing a physical assessment today. It's going to require me to touch you, listen to your lungs and your heart, ask you some questions. Are you comfortable with that today?
Sure.
Are you in any pain today?
No pain.
We've already assessed my patient's vital signs. They're all within normal limits. Okay, Mr. Jones, we're going to begin with your assessment of your head. Have you had any bleeding or any discharge from your nose and your mouth or anything?
No.
Any complications with hearing or ringing in your ears or blurred vision?
No.
Excellent. Okay, I'm going to visually inspect my patient's head and neck. I'm just grabbing my imaginary pen light. Inspecting my patient's ears for any discharge. Patient's nose for any discharge. Palpating my patient's neck. It's soft and supple. All right, sir, I'm going to go ahead and assess your pupils. Just please look ahead for me.
Okay.
All right, excellent. And keeping your head still, I want you to follow the tip of my pen here, okay? Excellent. All right, go ahead and open your mouth and say, ah.
Ah.
Checking the oral cavity, for any bleeding, any redness, any swelling. Go ahead and stick your tongue out for me, sir. Straight out. Excellent. And back in. Assessing for his cranial nerves that are intact. Go ahead and frown for me. Smile for me. Puff your cheeks. Purse your lips. And clench your teeth. Excellent. Okay. And raise your eyebrows. Excellent. And go ahead and shrug your shoulders. Excellent. Okay. We're going to move into the respiratory assessment. Have you had any difficulty breathing at all recently? No shortness of breath? Any cough at all?
No.
Can you go ahead and remove your shirt for me?
Sure.
I'm going to be assessing my patients for any difficulty breathing, any accessory muscle use, any retractions. I'm going to go ahead and begin by, can you turn sideways, and we're going to assess some tactile fremitus.
Okay.
I'm going to ask you to say 99.
99.
Again.
99.
Again.
99.
Last time.
99.
Excellent. Go ahead and percuss. Excellent, so you can straighten up again.
Okay.
The tactile fremitus, we got some light vibration, which is expected and normal. On percussion, noting for any dullness or any sharp response, for any blood or air in the wrong location. I'm going to go ahead and auscultate in 8 posterior locations and 6 anterior locations. So just go ahead and breathe normal for me, okay? All right, excellent. And on the front. Excellent. I'm going to go ahead and inspect my patient's skin. Throughout this whole exam, I'll be inspecting my patient's integumentary system for any swelling, any bruising, any rashes, any complications with that. Have you noticed any skin problems, any rashes, or any problems with those?
I have not.
Excellent. And coming to my patient's hands, checking for any clubbing, color in his fingers, any cyanosis, brisk capillary refill in his hands, also in his toes. Checking capillary refill, any edema, any swelling, none noted, no pitting or any weeping edema. We have completed our respiratory assessment. We're going to go ahead and move into the cardiac assessment. Have you noticed any chest pain, sir?
No, I haven't.
Any palpitations?
No palpitations.
All right, excellent. I'm going to come in and palpate his apical pulse. Palpating for any thrill, I'm going to go ahead and auscultate. It's strong and regular as expected. And now I'm going to go ahead and listen to your heart tones. Okay, sir? All right, excellent, sir. So your heart tones are all regular and normal. I was checking his atrial heart tone in the second intercostal to the right of the sternal border. To the left of that location, on the left sternal border of the second intercostal, I auscultated his pulmonic valve. Both of those, the S2 will be greater than the S1. Moving down to Urb's point at the third intercostal space left of the sternal border, S1 will equal S2. At the fourth intercostal space left of the sternal border, I'll be auscultating the tricuspid valve, and where S1 is greater than S2, and then down to the mitral valve at midclavicular line will be S1 will be greater than S2. Assessing again his fingers for any capillary refill issues, and toes down for the same, and for any edema. I'm going to go ahead and palpate pulses. One at a time for the carotid, bilaterally at the same time for the brachial, bilaterally for the radial. We'll defer the femoral pulse. Sir, can you go ahead and lay down for me?
Okay.
Excellent. Checking your popliteal pulses, posterior tibial, and lastly the dorsalis pedis. Excellent. All right, we're going to go ahead and move into our gastrointestinal assessment.
Okay.
Have you been in any GI distress recently? Vomiting, nausea,
No.
diarrhea, nothing like that? I'm inspecting my patient's abdomen. It looks flat. No redness, no swelling, no scars, no pulsatile masses. I'm going to go ahead and auscultate my patient's abdominal aorta. No bruits heard. I'm going to go ahead and continue to auscultate my patient's abdomen in 4 quadrants. Normal active bowel sounds are heard in all 4 quadrants. Go ahead and percuss. Normal response. Go ahead and palpate. My patient's abdomen is soft and non-tender in all 4 quadrants. No pulsatile masses, no rebound tenderness felt. Sir, have you had any urinary issues, any frequency, any blood in your urine, any concerns with that? Okay. Follow my patient's bladder. It is non-full and no pain upon palpation. All right, sir, we're going to go ahead and move into some range of motion exercises. Have you noticed any issues with your joints, any redness, any swelling, any concerns there?
No.
All right, throughout this whole exam, we'll be monitoring my patient's joints for any swelling. Sir, can you raise your right leg and put it down? Excellent. And same with the left leg. Excellent. Put it down and both together. Excellent. Put them down. All right. Push on my hands like car pedals. Excellent. Pull up. Excellent. Okay. And now I'm going to move your knees. You let me know if they hurt at all. Okay. Extension and flexion of the knee.
Okay.
Any pain?
No.
Excellent. All right. We're going to move into your hip. Internal, external rotation. Any pain in your hips?
No pain.
External rotation, internal rotation of the hips. No pain?
No pain.
All right. Excellent. Sir, you can go ahead and sit up for me. All right. On top of your knees, can you go like that real quick for me? Excellent. Okay. The cranial nerve assessment. You can go ahead and stand up for me, sir.
Okay.
All right. Excellent. Touch your chin to your chest. Any pain?
Okay.
Excellent. Rotate your head in a circle both directions. All right. Now rotate back the other way. Excellent. No pain?
No pain.
All right. Raise your hands to the sky and behind your head and behind your lower back. Any pain?
No pain.
Excellent. Stick your arms out to the sides. Forward and backward. Excellent. No pain?
No pain.
All right. Excellent. Stick your hands out straight for me and bend them several times at an elbow. Excellent. All right. Keep them bent once more.
Okay.
Push on my hands. Pull on my hands. Excellent. Let me see your fingers. Make fists for me. Excellent. Squeeze my fingers. Excellent. Let me see. Can you go like that with your hands again? Supination's intact. And we're going to assess his wrists. No pain throughout any of this?
No pain.
Excellent. Okay, so my patient's range of motion through his upper and lower extremities are intact. He has no pain on movement. His strengths are, muscle strength is appropriate. Go ahead and have you stick your arms out at your side and close your eyes. And with one hand, don't you touch your finger to your nose.
Okay.
And then do the same with the other one. And then do that a little bit faster, alternating. Excellent. All right, go ahead and stop. Put your arms at your side. Keep your eyes closed. and stand there for 20 seconds. I'm assessing my patient's Romberg test, looking for any instability in him standing. I don't see him swaying at all. That's a Romberg negative. Okay, so you can go ahead and open your eyes for me.
Okay.
Can you walk over here? I want you to walk the length of the bed. Excellent. And on your return, can you do heel to toe for me?
Okay.
Excellent. My patient's gait is stable and appropriate. I don't notice any instability. Have you noticed any issues with your gait or walking or tripping at all?
No.
No, sir? Okay, excellent. And then lastly, we're going to come over here, and I just need you to, we're going to do a couple last things with your legs here. Okay, and take your right leg and push it forward and backward and out. Excellent. And do the same with your left leg for me. Forward, backward, and outward. Excellent. Any pain?
No pain.
No pain. All right, stable gait. Go ahead and have a seat for me again, sir. All right. So your exam was normal. No abnormalities noted.
Okay.
No pain during any of this. Do you have any questions about anything that occurred?
No.
All right, excellent. I'm going to go ahead and sanitize my hands, wash my equipment. I'm going to cover my patient. You can go ahead and put your shirt back on, sir.
Okay.
Allow for patient privacy. After he's dressed, we'll open the curtain again. We're going to document all of this as appropriate. And that will complete our physical assessment.